The holidays, they sure are a fun and festive time, but that doesn't mean that we need to neglect taking extra precautions to preventing injuries. We're going to review some important safety concerns and steps to keep in mind for an injury-free holiday, and we all want that, don't we? We are joined by Cone Health's Urgent Care Medical Director, Dr. Philip Lamptey. First off, let's just talk about something that happens very commonly this time of year when we're putting up Christmas lights and things. We're talking about falls.
Yes, falls are one of the common things that happen when we're putting up our Christmas lights and all the decorations and the fancy stuff that we do. The cords are actually one of the things that people get caught in or trip over, especially the young ones. So we should always make sure that the cords are tucked away in areas where you're not likely to have your feet caught in that. Other things also are the ornaments and toys, and those ones should be kept free from the pathways, just to make sure that nobody steps on it or trips on it and falls. When we're setting up our trees as well, we need to make sure that we have ladders on hand so that if you cannot reach all the way up, you're not stretching or leaning on the Christmas tree. And we'll also make sure that those decorations are on a base that is flat so it doesn't wobble. The other thing is, if you have medical conditions or medications that makes you unsteady, putting up these trees can be very challenging, and that is usually something that you need to seek help for.
Okay, so we need to keep those things in mind. I think, a lot of times our Christmas houses are kind of a little bit cluttered here or there because we have a lot of things, and you're reminding us, hey, make sure that we have good pathways to walk. The other thing that is big over the Christmas holidays, of course, toys and food, and therein comes the choking hazards. Tell us what we need to be aware of.
Yeah, so choking is a very dramatic event and very unfortunate if it results in mortality. What I'll say is that in 2019, there were 5,200 deaths from choking. And 75% of those are in kids under the age of 4 years. So we always have to be mindful when we are during these holidays. We think about things that could present as choking hazards. So things like small toys, ornaments, balloons, small balls and marbles are some of the items that could present as choking hazard. And also, if you think about food, you think about hard candy, sticky candy, nuts and seeds, chunks of raw vegetables and meat, as well as popcorn and things like whole grapes. Basically, you can think of it as if anything that could fit in the toilet paper, the tube of the toilet paper, potentially is a choking hazard, can present a choking hazard. So that would be a rough estimate of what would be choking hazard for kids, especially.
Okay, so you see in urgent care lots of people coming to you with all kinds of different injuries. We talked about the falls and we talked about choking. Let's now talk about fire safety and burns and things of that nature.
So with fire safety, I always say that you can break it down into three. You think about knowing the basics when it comes to fire safety and fire prevention, getting basic resources that you can keep at home and also being prepared. With basics in terms of information is to know how to use a fire extinguisher, knowing to pull the pin, aim at the base of the fire, squeeze the handle, and then use the spraying motion to put out the fire whilst you stand 6 to 8 feet away, making sure that you know it to stop, drop, and roll, cool and call if you fall, if you're caught on fire. And usually these are, if they're small fires like your clothes is caught on fire and things like that. And having the basics is basically having a fire extinguisher at home handy so that if there is any small fire outbreak, you can put it out very quickly. Also having smoke detectors, smoke alarms. And with those ones, I always say, think about 1 month, 1 year, and 10 years. 1 month, you should clean it every month. Make sure that you test it every month. For every year, if it does not have a lifelong battery, you have to change the batteries every year. And then 10 years, you change the whole smoke detector. Also, having carbon monoxide detectors at home is very handy, given that we are in a cold weather and most people will be indoors for longer periods of time.
Okay,
And
so go ahead. Go ahead.
Yeah, the third part will be being prepared. So with being prepared, you have to know your house, know your house plan. I'm teaching everyone knowing how to call the fire department and 911, and also agreeing on an assembly point outside the house that everybody is expected to go in case there's a fire. If you have young kids at home who are less than 5, if you have elderly people who have physical challenges, and if you have special needs people at home, you should always plan to have an adult help them out in case there's a fire at home.
Eat, drink, and be merry. Cheers to the new year. I mean, you hear it all the time. But let's talk about alcohol consumption and what you, as a doctor, want us to keep in mind.
I would say that with alcohol consumption, moderation is key. 2 drinks for a meal a day if you have to drink, and 1 drink for a female a day if you have to drink. If you don't drink because of the potential health benefits. And if certainly if you're pregnant, you're under the age of 21 or have medical conditions that will be adversely affected if you drink, then stay away from alcohol.
All right, so many people are going to be traveling this year. What do you think that they should be keeping in mind when it comes to their health?
I would say that, don't drink and drive or operate a machinery under the influence. Excessive drinking also has health risks or can adversely affect your health. So those are things that you keep in mind as well. And for the little ones, with all the festivities that we have, try and keep their napping schedule and their sleeping schedule so that they don't get too off their balance, because that kind of stresses them sometimes.
All of us, it stretches all of us, right? And makes us cranky
Yes.
when we don't get enough sleep. We all need to take that guideline. All right, we can't talk about holiday safety without talking about COVID this year again. So how do you say that we celebrate and be COVID safe at the same time?
The COVID message, central to the COVID message is get vaccinated if you have not gotten vaccinated. If you have been vaccinated and you're eligible to get a booster shot, please do get it. And if you travel and you are indoors with people you don't know, keep your mask on and social distance. And you can get testing if you feel sick. Now we have a lot of resources, home testing, testing sites in the community. So there's a lot of resources out there for testing. If you feel sick, get tested, and that is the best way to protect yourself and your family from the spread of COVID-19.
Well, this is always the question when something happens at home and you get hurt. Do you go to the urgent care? Do you go to the emergency department? Do you just hang out for 24 hours and wait and call your doctor? When should you go to the emergency department?
So if you have a life-threatening condition, somebody who has severe chest pain, is having significant difficulty breathing, those are things that, or is acting very confused or cannot move some of his body parts. Those are things that should be seen in the emergency department. If they are not life-threatening, then you could either reach the health system through a virtual access, which will mean that you be in the comfort of your home using your smart devices to access care, or go to the urgent cares, which we have in 4 counties, to seek care. With the urgent care as well, you can make an appointment ahead of getting there. That saves you some time that typically you'll have to wait for care to be delivered. So it cuts down on your waiting time.
Mm-hmm. All right, so any other safety or injury prevention tricks or recommendations that maybe people have not thought of?
I think one thing that A couple of things that I would say, if you're buying presents, you should always think about safety as well. So let's say you're buying a skateboard, you're buying a bicycle for your kids. Just make sure you add a helmet to it, because that always gives some safety to them should they fall. And also with all the plants that we bring into the houses, holly berries, mistletoe and stuff, you make sure that they stay out of reach of children and pets, because as we know, kids, with everything goes in their mouth. You don't want them to be ingesting those plants because they are poisonous.
All right, and one last thing, when we want to go back to the choking thing just kind of quickly. If someone is choking at home, should they call 911 immediately, or should they actually get to the person and try and do something?
So if the person is able to talk and has a good cough, most of the time they'll be able to cough up what is choking is blocking their airway. In those kind of cases, you don't need to do any maneuvers, but if you feel like they're still not able to clear up their throat, or if they're not able to clear up their throat and they suddenly lose their voice or begin to lose consciousness, you need to call 911 or let somebody there call 911 and immediately start helping them. If they can't breathe, they can't talk, or they have a muffled speech, or they suddenly lose consciousness, somebody around calls 911 and you immediately start helping them to try and relieve the obstruction.
Okay. All right. Well, thank you for your time and your expertise. We appreciate it. And of course, we're hoping for safe holidays for everyone. If you missed any of this, you can find the information on our website, WFMYnews2.com.